good morning. I'm Jeff Campbell. I'm a urologist from Canada. I'm here today to talk to Cameron Pikula, a physical therapist, about a topic that we all really need to learn more about, and that is chronic pelvic pain. Appreciate you taking the time to be here with me today. You want to tell everyone who you are and what you do?
My name is Cameron Pikula. I'm a pelvic floor physical therapist at the Cleveland Clinic in Cleveland, Ohio. I've been treating pelvic floor disorders for almost 14 years and see all gender, all diagnosis, but I have a big interest in treating pelvic pain. So thank you for having me today.
Perfect. Well, we have the right person then to ask all of our questions to then. So I want to, maybe we can introduce to the audience, what is chronic pelvic pain? And when patients are given that diagnosis?
So it's a really broad description of any pain in the pelvis region that's been going on for more than 3 months.
What symptoms would people typically present with?
So it could be something, that sensation of like I'm sitting on a golf ball. It could be pain in their rectum. It could be pain between their legs. It could be vaginal pain, penile pain, clitoral pain, lower abdominal pain. So it can be really anything around the pelvic girdle region.
And how do we know, we hear a lot of other kind of chronic diagnoses that have similar symptoms, like chronic prostatitis or endometriosis in women. How do we differentiate those as diagnoses?
That's a great question. I think there's a huge overlap between these other medical diagnoses and a muscle-based disorder. Most of the time, they end up happening together. So it can be, a lot of questions come into, is it sitting? Is it standing? There are certain triggers to their symptoms that can give us a better idea. Now, for a patient that has endometriosis-based pain, sometimes that's more purely cyclical. But we can see that it varies in symptoms, it varies in intensity, and can be very functionally limiting. It's usually worth taking a look at to see if there is a muscle component happening with their pain and their symptoms.
So you touched on something that I think is really important. So we see these patients as urologists all the time, and they will usually come to my clinic with a normal ultrasound, a normal CT or MRI or some other abdominal imaging, and these kind of vague symptoms. And everybody's a little bit different. There's not much, one size fits all. But are there certain cues or symptoms that I should be looking for that kind of flag, like this is much more likely, a muscle problem as opposed to something else?
I think if it matches with an exertional activity, right? Is it ejaculation? Is it orgasm? Is it with penetration? Is it with urination or bowel movements? So with movement, sometimes can give you a little bit of a better thought of like, maybe I should look at the muscle system more. And I think it's helpful, from a referring provider standpoint. I always tell our providers, I'm not looking for you to be able to say of like, it's this exact muscle, really. You're looking at ruling out the big scary stuff and saying maybe there is a component, and then referring to a pelvic floor physical therapist or a physio and seeing, is there a muscular component with their symptoms?
I think that is great. And I guess the question, I could refer hundreds of people to physical therapy. And truthfully, I think everyone actually would benefit from seeing a physical therapist. But I guess also, what are the symptoms that should maybe flag that you're not the right person to go to immediately, or maybe I should be doing a bit more investigation first?
Yeah, I think if they're having groin pain, that can be one of those tricky ones. I would say, if you're comfortable taking a look at their hip range of motion, right? We know pain can refer in the pelvic region, but they also can have severe hip arthritis. Or if they're having, innate loss of bowel and bladder control, if they're saying, oh, I'm having incontinence, I'm having pain, when you start looking, but they're having lower extremity motor weakness, that's a pretty good indication they probably should get some imaging. And it could be an orthopedic driven symptom and not purely just a pelvic floor muscle based symptom.
Right. And similar to as you were saying before, I think a lot of those probably go hand in hand. But the referred pain to the pelvis is such a common thing, and it's a muscle group that people don't think of. So they don't understand. It's very hard to, convince patients that, oh, that hip pain that's actually why, you get pain into your testicle, or you get pain underneath your testicles, or if into your bladder. So, but I think the referred pain is a real key there. So in Canada, our wait times to see most physical therapists probably range for 2 to 6 months, and depending if you're in more of a rural area, sometimes even longer than that. which is a long time for someone to wait, especially, I mean, most of these people have probably been suffering for years. What are things that I can do in the meantime while they're waiting to see a physical therapist to help them with that treatment plan?
I think having a good resource, even if it's a piece of paper explaining some options. So looking at, there are a couple really good books. A Headache in the Pelvis is one of them. Why Pelvic Pain Hurts. Explain Pain can give a kind of an idea of why is this happening. I think focusing on, relaxation strategies and mindfulness and trying to get general exercise in, looking at yoga. There's some really cool YouTube videos for yoga for pelvic pain, and looking at trying to relax. The hard thing with pelvic floor is it doesn't necessarily cross a lot of joints. So there's not a lot of stretching, but we use a lot of stretching in the muscles and joints and around the pelvis to be able to help relax. So hip opening, which is where that relaxation or slow flow yoga can be really helpful. There's also some really good studies looking at general aerobic exercise in a moderate intensity for 10 or 15 minutes, being able to help with pain modulation. And I think another one that we sometimes take for granted for is sleep, right? We know if we're not sleeping, if we're not getting rest, then pain levels tend to be higher as well. So focusing on some of those, which seem silly, right? Stress management, sleep and nutrition and hydration and all those things that really can be helpful. And then looking for some yoga-based stretching and pain modulation exercise can be helpful too.
Yeah, I think it's very important to have those resources available to I have in my practice, I have a couple standard sheets that I would give to patients, kind of depending on what their symptoms are, as at least something to do to give them some hope. The other important thing really is, I mean, a lot of patients don't believe me when I say exercise, sleep better, stop smoking, like all the regular lifestyle things will actually treat their pain, especially because they've usually been around the healthcare system for a while, right? They've seen other providers. Pain validation, I find, is also important, where you actually telling, I believe you have pain, even though I don't see anything wrong, but there's a pain here that I can't fix. And so how do you introduce pain as a concept when you kind of meet patients for a first time and introduce maybe what their journey is going to look like?
Yeah, one of my favorites is talking about the sensitive nervous system, and talking about an alarm system. So we think about alarm on a house, and that alarm system is intended to protect it, right? Our bodies try to protect themselves. But imagine a spider going across the alarm and the alarm going off. You're like, your body doesn't understand that spider is not harmful. Burglar, absolutely, we want to know that coming in their house. But explaining that nervous system and protection response, sometimes, and we know the longer the pain's been there, we talked about chronic pain being more than 3 months, but I agree, most of my patients had at least 5 to 10 plus years of symptoms. And so talking about those ways that it's not necessarily their brain, it's not in their head, but their brain has then changed the adaptation of the way that their body's processing what the information is that's being given to it.
I love that analogy. I mean, I think I'm going to start using that one. I love analogies. And the other thing that you touched on is people are often told it's in their head. And it kind of is, because your brain does control how you perceive pain. It is a perception. But it has such a stigma when people are told, oh, it's all in your head. But it is, but it's not their fault. It's not their fault. It's in their head. What about resources for, coping with stress and mental health, and kind of understanding that process?
I think it's very helpful for patients that have that history I think it's very helpful for the patients that have pain to have a mental health psychologist or counselor or someone they can talk to be able to get some strategies, to be able to help modulate their symptoms too. We know there's a very high correlation with anxiety and depression, and a history of trauma and abuse. So trying to be able to have strategies to be able to help cope with those things that can also help in turn help their pain get better as well.
Yeah, it's such a difficult disease to manage, but so many multidisciplinary resources are really needed for these patients. Is there any last words of wisdom you have for either patients suffering from pain, who have not yet actually been treated properly or diagnosed. And then also two-sided question here for the providers who are seeing these patients and often saying, there's nothing I can do.
I think at least giving them a resource of getting someone to help, right? But then also encouraging of finding, maybe you went to pelvic floor physical therapy, maybe you tried it, didn't mesh with the provider, or they're having pain and they're doing all strength-based exercise, of keep looking, find a different provider, try something different. We know it can take a while to be able to help learn how to modulate the symptoms and help to manage these symptoms, but there is ways and strategies to be able to help improve that quality of life.
Awesome. That's great words of wisdom. I appreciate you taking the time. Thank you very much.
Thanks so much for having me.